My name is Erica Lee, a dermatologic surgeon at Memorial Sloan Kettering Cancer Center. I am the lead investigator in an international research group that developed a new patient-reported outcome measure called the FaceQ Skin Cancer Module. The development and validation is published in the British Journal of Dermatology. We did this study because there are millions of skin cancers diagnosed all over the world every year, and the vast majority will occur in the face. Surgery is often performed, which can leave patients with a visible scar, and this in turn can have significant psychosocial implications. Therefore, how the patient feels about the scar, as well as their aesthetic satisfaction with surgery, are now being recognized as critical treatment outcomes. Therefore, our group developed a new patient-reported outcome measure called the FaceQ Skin Cancer Module. Now, in this module, it consists of 5 independently functioning scales. You have 2 appearance scales looking at overall facial satisfaction and the extent of scar bother. We have 2 quality of life scales that look at cancer worry and appearance-related psychosocial distress, and we have 1 patient experience scale that also looks at patient satisfaction with information. In this study, the scales are psychometrically analyzed to select the best items for the final 5 scales and to validate their use in the skin cancer population. The study was performed at Memorial Sloan Kettering in New York City. The scale was field tested in over 200 patients, and we had 2 patient groups. The first group received a set of scales before and after surgery, and the second group received the same set of scales, but on 2 different occasions in the postoperative period. The different items were psychometrically analyzed to look at different fit criteria. We looked at indicators of reliability, floor and ceiling effects, and also correlation between the scales. Our main findings show that our scales fit or meet the criteria of the RASH model and allowed us to select the best items for final inclusion in the scales. The scales demonstrated high reliability, and the cancer worry scale was also shown to be responsive. The scales also correlated, which means, for example, if you had more cancer worry, this was associated with more psychosocial distress, and as hypothesized, correlated with lower appearance satisfaction scores. And finally, there were some floor and ceiling effects, which means that a limitation of the scales may be when it comes to differentiating between patients with minimal impairment. But in skin cancer surgery, it's not unusual to have some patients with minimal or no impairment, whereas others will have significant impairment after surgery. We feel this study is very relevant for both dermatologists and plastic surgeons because we now have a patient-reported outcome measure that incorporates appearance satisfaction with the quality of life effects of surgery. Also, by using the RASH model, this allows us to use the scales at an individual patient level and to make it very clinically meaningful. And finally, it can also be used for group or research efforts to provide rigorous data, which in turn really can impact our specialties and improve the care that we provide all patients. Thank you.